Knock, knock, knock. Hi, Mr. Lardell. My name is Tiffany. I'm going to be your student nurse today. How are you doing? Good. I'm good, thank you. Do you mind just verifying your first and last name? Mitchell Lardell. Okay. And your date of birth? 5/14/91. All right. And that matches up perfectly with the EMR as well, so we're good there. Mr. Lardell, do you have any allergies? No allergies. All right. So I'm here to give you your insulin. The nursing assistant told me that your blood glucose level was 250, which means per your doctor's order and your sliding scale, you're going to get 5 units of insulin. Do you have any questions? No? Okay. So I'm just going to go ahead and prepare your syringe right now. And I'm going to perform hand hygiene again since I did touch the patient. I want to do that before I prepare his syringe. So I did the first 2 checks in the medication room, which means that I checked the medication after I pulled it out of the drawer to make sure it was the right one. And then I checked it up against the EMR to make sure that I'm going to give the right medication to the right patient. So now that I'm in the room at bedside, I'm going to do the 3rd check. So I'm going to make sure that the right patient is getting the right medication at the right time, in the right dose, through the right route, for the right reason. So since that all checks out, we'll go ahead and prepare the syringe. So I'll take a fresh alcohol swab and just clean the top of the vial. And since I need 5 units of regular insulin, I'm going to first inject 5 units of air into the vial. Okay, and I'll aspirate 5 units. I want to be careful not to touch the plunger while I am aspirating. Okay, and since this is an insulin needle, they're very fragile. So if you do happen to get an air bubble, you can gently tap. Like I said, you want to be careful because these needles are so fragile. So I'm going to pretend like I have a nurse here to double check me. Just to double check that I do indeed have 5 units of insulin. 5 units of insulin there. Okay. And since I don't need this right this second, I'm going to use the scoop method to recap for now. Okay. All right, Mr. Lardell, I'm ready to go. So I'm going to go ahead, do hand hygiene. I'm going to put on some clean gloves. I'm going to raise his bed up to a comfortable working height for myself, and I'm going to lower his bed rail on the side that I'm on. Mr. Lardell, where was the last place they injected your insulin into? Here? Okay. So I'm going to inject this insulin into your lower left quadrant. Do you mind just pulling up your shirt for me, please? Okay. And I'm just going to double check and assess to make sure that there's no bumps or bruises in the injection site. And I'm going to start by cleaning the area. I'm going to take a fresh alcohol swab. And I'm going to clean in a circular motion starting in the center outwards. And I want to let the air dry. I don't want to do that, and I don't want to blow on it. You want to let it air dry. Okay. So now that that's dry, and I have the syringe ready to go, we're going to go ahead and administer it. All right, Mr. Lardell. So this is a subcutaneous injection, which means you can go 90 degrees or 45. Since this is an insulin needle and they're smaller in this patient, I'm going to use a 90-degree angle to administer this. So I'm going to pinch your skin here, Mr. Lardell. And on the count of 3, 1, 2, 3. And I'm going to slowly inject the medicine. Okay. And you want to remove the needle in the same angle in which you inserted it. So I'm going to come out at a 90-degree angle. And I'm going to immediately activate the safety. Okay, I'm going to release. And since there's a little dribble of blood, I'm just going to gently apply pressure to the site with a clean gauze pad. Okay. And then I'm going to dispose of this. I'm going to dispose of the needle into the sharps container. I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to lower his bed back down, raise up his side rail, cover him up, make sure that he's comfortable. Ask if he has any questions and perform the 5P check. So I'm going to check to see if he needs to use the bathroom, has any pain, check his pumps and plugs, ask him if he knows where his personal belongings are, and check his positioning. So like I said, to just make sure that he's comfortable. I would perform my documentation, do hand hygiene, and leave the room. Make sure he has his call bell on him. Now, if this was an intramuscular injection, there's two main sites that we use, so the deltoid muscle or the ventral gluteal muscle. To find those sites, to find the deltoid site, you're going to feel for the patient's acromial process. When you find that, place 2 fingers below that. And then you're going to use your other hand to make a V underneath your bottom finger. And right in the center of that V is going to be your deltoid site for your intramuscular injection. For the ventral gluteal site, you're going to use the ulnar side of your hand, or the ulnar surface of your hand, and you're going to find the patient's greater trochanter of their femur. And that's where you're going to place the ulnar surface of your hand. And you're going to align your index finger with their anterior superior iliac spine, and you're going to align your middle finger with their iliac crest. And in between those 2 fingers is going to be your injection site. Now you're going to use your left hand on their right hip, or you're going to use your right hand on their left hip. So once you find the injection site, you go through the whole entire procedure as you typically would, as normal, like I did before. You're going to use a different needle, of course, so use what's appropriate for the circumstance. And I'm going to show you how to use the Z-track method here. So for intramuscular injections, we're going to use a 90-degree angle. Okay. So I'm going to pretend like there's something in here. It's not letting me inject it into my patient here. So we're just going to pretend for the sake of the video that there's something in this syringe. So for the Z-track method, you're going to use a 90-degree angle for the intramuscular injection. You're going to hold the skin taut, but you're going to pull it back about 1 inch. And on the count of 3, we're going to insert 1, 2, 3. And you're going to hold the skin there, and you're going to slowly administer the medication. So about 10 milliliters per second. Once you administer it all, you're going to hold the needle there for about 10 seconds while still holding the skin taut with your other hand. After the 10 seconds is up, you're going to remove the needle in the same angle in which you inserted it. So 90 degrees. Going to immediately activate the safety. Place aside. And then you're going to release the skin and allow it to go back to its normal positioning. And that is how you perform the Z-track method.